Hello everyone, my name is Yi. I am an applicant of Health Plus Plus project. I would like to talk about a really considerable problem in healthcare and how I want to use modern technology to tackle it. I want to talk about medical examination and diagnosis. In many developing countries, people often don't go for medical examinations until they feel severe symptoms. There are two main reasons for this. The first thing is that most of the hospitals in those countries are crowded and the procedure for medical examinations is complicated that people don't want to go there often. Only people in a better financial condition can go for private medical checkup. The other reason is that people in these countries mostly don't have much knowledge about medicine. They prefer using drugs recommended by acquaintance rather than doctor. Even in developed countries, medical examination is also a big problem since sometimes people are too busy and don't have time to care about their health. I have been considering this problem for a long time and realized that the main point is how to tell people when they should go to hospital, or in other words, how to give them a quick health check. That gave me an idea about making a mobile application for self-medical examination using machine learning. The idea is that I will collect data about 1,000 common diseases, their symptoms, as well as how to cure them, and let the computer learn which symptoms belong to what kind of disease. When the user opens the application, they can choose the symptoms or add a new symptom if it isn't written in the list. Then the application will tell them the disease they might have with the probability and advise them on what they should do. For example, if it's simple, the application will suggest some method to cure it, such as over-the-counter medicines or rest. Otherwise, the application will tell them to go to hospital. Since I have worked on image recognition using deep learning, I also want to apply this field for medical examinations. Sometimes people don't have time to choose the symptoms, or they want to make sure by adding their photos, like to show the doctor in person, and through that the doctor can diagnose which disease they are suffering from. My app will be able to recognize a disease via the user face or appearance. For this, I will collect the photos of the patient with those kind of disease, maybe 1,000 pics per disease, and let the computer learn about that. So when people want to check their health, they can show the mobile app their face or their appearance first to have a quick check. Then they can choose the symptoms later if they have time. As long as I can collect enough data, I think there is no difficulty in turning the idea into practice, since the algorithms are not new and have been used in varying applications, and some of them are even available free in the internet. For people in remote regions or poor people, it may be hard to have a smartphone to use this application, so I am thinking about create a diagnosis system using phone calls. In other words, instead of checking the symptom list, people can list their symptoms and get advice from the system. This one is related to voice recognition and auto-generated voice, which means more complicated technology is required. If it's possible, I want to keep this one in mind and research about it in the future. If I succeed with this application, I also want to work on another similar idea, develop a mobile application to recognize toxic food. Nowadays, there are lots of people try to use harmful chemicals to make the food tastier or make the fruit look fresher. If there is an application to recognize which food contains unhealthy components, it would be beneficial to society. I can create it by collecting the photos and information of toxic food and non-toxic food, then let the computer learn. People can provide the application with info or photos of the food they want to eat, and the application can tell them if it contains unhealthy chemical or not with the probability. So that's all about my idea. If I have a chance to join the Health Plus Plus program, I will talk more about that. Thank you so much for listening.